Why is resourcing important in EMDR therapy? And how much should I be doing it with my client? I'm Holly, I'm an EMDR therapist, and I'm an EMDR-approved EMDR basic trainer. So let's dive into it. The purpose of resourcing our client is so that they can maintain their window of tolerance while we work on these big memories from their past. And how much resourcing we need to do for each person is really going to shift. There's some people that I have to do almost no resourcing with because they have a pretty solid support system. They're able to manage their triggers. They have daily practices of self-care. I don't really need to do much resourcing with them. There's other clients where we might do some months of resourcing. And in the end, it needs to be a balance between me as the therapist, what I'm seeing, and the client. Because if I push a client to go too fast, that's probably not going to go too well. And this topic of resourcing is actually kind of controversial in the EMDR world, especially when we look globally. And there are a lot of therapists in Europe who actually think therapists in America over-resource our clients. It's a big hot debate, and it was even just talked about at the EMDR conference this year. And there really can be an over-resourcing of our clients, because in the end, if my client is having problems with their window of tolerance, dysregulation, what have you, it's related to their past trauma. And so this is our chicken or the egg thing, right? And so how much resourcing do we give, knowing that all the resourcing in the world isn't going to shift their trauma until we actually go in and reprocess their trauma. And a famous Francine Shapiro quote is, "The best way to resource our clients is to reprocess their past memories." So I'll admit that I tend to not over-resource my clients. Because I do agree with this comment actually, that we really want to desensitize the memories, but we need to be wise enough to know when we have to add in more resourcing. And one of the reasons I have to resource less is that I use the EMDR therapy flash technique with every single client on the first memory we work on across the board. Because this technique is kind of a light way to start working on a memory without diving deep into phase 4 unrestricted reprocessing. And then depending how my client responded, how they said their week was, I'll choose to either continue using the flash technique or I'll slowly shift to standard protocol. And that's the way I'm able to kind of jump in a little faster. But in the end, you really want to make sure it's a conversation between you and your client to make sure that they feel like they're ready to address the trauma and to reprocess.